Hi guys, it's John, your friendly neighborhood personal trainer and fitness instructor. So I know I do a lot of videos on encouragement, courage, vulnerability, lifting yourself up when you're down, motivational techniques, things like that. But I want to today get back to what it is I do best. Talk about the body and what you can do to alleviate pain you're experiencing, as well as any other issues in your joints, in your bones, things like that. So, I wanted to do a video today on the lower back because about 80% of Americans suffer from low back pain, or lumbago as it is called by the medical community. The 80% of people suffer from lower back pain in their lifetime. So 95%, however, of the lower back pain problems can be alleviated or eliminated by non-surgical methods. So either exercising, strengthening, or a combination of different techniques. So it's funny if you're not in my industry, or if you're not in the medical community, or something that allows you to know a little bit more about advanced anatomy and kinesiology and just how the way the body works. It's amazing how a lot of people don't understand the mechanics of it. So anatomy. So, when I was in school for many years, I had to take advanced anatomy courses, especially when I was at CCAC doing my physical therapist assistant program. So what I'm going to focus on here is your lower back anatomy, not so much the entire spinal cord. So your lower back anatomy. So it's an intricate and complex structure of bones, obviously, nerves, and muscles, and the nerves tend to innervate different parts of the body, so it helps with daily functioning of those organs, tendons, muscles, what have you. So there are three parts to the spine that I want to tell you about. So the first is the lumbar spine. So this is kind of where your lower back pain for most people is situated. Your lumbar spine has 5 different vertebrae that are responsible for various body functions and various mobility movements. So it helps in rotational movements. It also helps in bending movements, and I'm sitting down, so obviously I can't bend down. The next part of your spine is your sacrum. So your sacrum is basically, it starts pretty much at the small of your back, and it has also 5 vertebrae. This goes down to probably basically right above your butt. So after the sacrum, you have what's called the coccyx. So there are 5 vertebrae here, or there's 4, excuse me. But the only difference is that they're fused. So it's just one big bone, but it's kind of sectioned off a little bit. So if you saw it under a microscope or what have you, you'd be able to tell the different vertebrae discs, or vertebral discs, excuse me. So there's thousands of nerves that innervate through these vertebral discs. There are these little holes called processes. So what the nerves do, if this was a process, the nerve basically would go through and out into the body part or body system, and it would send signals as well as receive signals. So that's some bing bam boom anatomy. I don't want to take too much time on it because there's a couple other things that I really want to focus on. So concerning your lower back, there's a couple of common issues and common problems that I see in my work, as well as in the medical community, excuse me, as well as physical therapy, chiropractic care, and things like that. So the first one is disc herniation. I hear this all the time from people. What is disc herniation? So it's either damage or injury to a part or full injury to a disc. So basically, when that rubs when you move and when you walk, there's going to be friction. So, and that friction obviously hurts. So the more you let it go, the more it worsens. So the more you let it go, it could turn into this next problem, which is osteoarthritis. So basically, it's the breaking down of the cartilage in between the bones. So basically, what you have is bone on bone. So the bones are just rubbing together and they erode after a period of time, and it's very, very, very painful. Those are two of the biggies. So other ones are things like pulled muscles, or something that goes completely the other way and is a little more intricate. Something that I have, so I can speak on this. I have what's called pelvic tilt. So this is a structural issue. So my good friend Andy, a long time ago when I brought this to his attention, Andy is a trainer, and a damn good one too. So if you're ever in South Carolina, look him up. But anterior pelvic tilt. So if this was the front of you and this was the back of you, anterior means forward. So the bones are going to slide forward, therefore pushing your backside out. So basically that's what I've got going on. And the back pain that is associated with this, at least for me, because I've had this for over 20 years, it hurts a lot. And so what I've done is I've seen numerous physical therapists, and I'm seeing two chiropractors. They're both at the same practice, but they have addressed issues that I've never seen prior in meeting with physical therapists in the past. So side note, so when I was in school for physical therapy, one of my professors always told me, you never want to go see chiropractors. And I was like, well, why? And don't we pretty much do the same things? And he's like, well, physical therapists usually have some sort of treatment plan, and they it's a little bit more medically sound, because they have a lot more techniques and things that they utilize, like e-stim, as well as various exercises. They also have injections, things like that. So when I started to think about how to deal with this lower back pain. And when I started working at the gym as a trainer, we had a member there, Mario, who I've talked about on previous videos. I talked to him and I was just like, okay, here's what I got. What can you do for me? And he said, come in, we'll do an eval, we'll talk about it. So I was a little bit skeptical at first. This was a year ago, a little more than a year ago. So what I've experienced within that year and some months is less back pain, an increase in testosterone, which I do have low testosterone as well, so that's a plus. And just my mood's better because my back isn't hurting all the time, and so there's added benefits as well. But if you want to separate physical therapy versus chiropractic care. So I'm going to skip a little in what I was going to talk about. So PT versus chiropractic care. So both disciplines have the same end goal. They want to alleviate your tension, alleviate your pain, and restore your mobility so you can get back to your activities of daily living without any added pain. So let's start with chiropractic care. So basically what chiropractic care is, in a nutshell, is you have a practitioner, and what they're going to do is they're going to manipulate the spine and the muscles around it utilizing certain table techniques or certain manual techniques. They also have, at least on me, they use this thing. It looks like a gun, and they just shoot it, and it kind of, at least to me, this is how I'm going to describe it. It delivers a jolt to your spine. So basically, you have vertebrae and the space in between the vertebrae. So what you want to try and do by way of this gun is you want to widen the space in between the vertebrae so you have less tension and less pain. And so you'll sit up straighter and everything pretty much falls into a perfect posture that we all strive for. So that's basically what the scope of chiropractic care is in a nutshell. So some patients will feel relief after just one session. So word of caution though, because I brought this to my chiropractor's attention once, and I was like, is this normal? A lot of people will feel tension and discomfort at least 24 hours after being adjusted. This is perfectly normal and perfectly natural because, of course, if you're manipulating a muscle or a part in the spinal cord, it's basically like putting your finger in a fresh wound. If you massage it, you're gonna have some referred pain for a while. So usually chiropractors will tell you just, ice it, and that should alleviate any discomfort that you're experiencing. So it's important to realize that, yes, there can be micro tears in your muscles from being manipulated and things like that, but in my personal experience, the experience has been very positive. And I like the progress that I'm seeing. My mobility is better. My breathing is better. And just my entire mood is a lot better. So I'm going to totally endorse chiropractic care. So, that being said, physical therapy. So, this is where my background is. So, physical therapy. So, what is it? So, basically, physical therapists, as well as physical therapist assistants, will administer treatment plans. And these treatment plans basically are based off of what your injury is. So, when I used to work at Mercy Rehab downtown, I assisted with a lot of stroke patients, brain injury, spinal cord injury, as well as bone breaks, things like that. So basically, the therapist would create a treatment plan and build goals. Well, we want John to be able to stand on his own, bearing his own weight by such and such a date. They can be very specific goals. They can be short-term, medium-term, long-term goals. So that's basically what a treatment plan is. So there's different types of treatment that physical therapists will use to try and help the process along. So depending on whether you're in an inpatient clinic or an outpatient clinic, the type of treatments can vary. Also, the type of physical therapist specializations can vary. So always do your research before you seek out a certain PT. So they can do manual therapy, they can do e-stim, they can have you do stretching exercises, they can also do injections now. It's very specific on what PTs and physical therapists and the community in general are able to perform non-surgically, which is awesome. So the effects from the physical therapy program, they're going to be seen a little bit more long term because you're not trying to go from 0 to 60 overnight. You're trying to retrain muscles, and that takes a lot of time to send the signals to the brain, and the brain sends the signals to where they need to go. I think your body has to do a new skill. You have to do the same movement over 3,500 times for your brain to get it. So obviously this is going to take a little more time, but the payoff is going to be a lot better. So treatment plans are executed to assist the patient to gain functionality and obviously take the pain away or just kind of lessen it a little bit. Usually the patients that I assisted in seeing, they had a lot of accompanying issues that led to why they were getting physical therapy. So-and-so had a stroke. They fell, so they fractured their hip, or they broke their foot. So usually with the patients that I was seeing, they needed PT as help to an injury they got from having a stroke or becoming brain injured or what have you. So the physical therapy part is just assisting all the other treatments that they're getting to get better, if that makes any sense. So to kind of put this in perspective, because I have people at my place of employment that I see and that I train ask me, well, what do you do for, back pain, and what techniques are there? So when I worked in multi-disabilities education as a teacher's assistant, I was working with students who had cerebral palsy and a lot of other disorders that we would have to lift the kids, position the kids, things like that. So I remember when I started there, during our in-service week, the physical therapists, they provided some tips on how to save your back, essentially. So a lot of these are coming from that because they're very simple and they can save a lot of pain in the long run. So first is, and everybody knows this, lift with your legs, not with your back. So when you're going to pick something up, don't bend down at your waist. Bend from your legs. Bend your knees before you bend your back, because that's going to save a lot of pain in the long run. 2, you want to keep the load close to your body. So I'm going to use this book. Let's pretend this was a person. So you don't want to hold them out here. You want to hold them as close to you as possible. Why? Because you have a better handle on the weights of the individual if they're closer to you than if they're out here. Because if they're out here, your arms tend to tire a lot quicker than if they're here. Also, if you have a child who's squirming, this is going to fare a lot better than dealing with something out here. So that's tip number 2. Tip number 3, and I am a very huge stickler on this at the gym, stretch. So there are tons of lower back stretches. Seriously, you could Google back stretches and you'd get tons and tons of results. So I'm going to tell you, just kind of to wrap this up, do your research. So if you're experiencing lower back pain, get the correct information from your doctor, and kind of brainstorm with him to see, should I seek out a physical therapist? Should I see a chiropractor? What's the right avenue that I should take? So, also, just be cognizant of how you're moving and your body mechanics are. When you're lifting heavy things or, positioning things around the house. Even if, like, I was dusting earlier and I'm only 5'3", so I have to really, reach for some things. So if you're reaching a lot, you could be putting distress on the nerves and the bones of the lower back, and it's just not going to feel good. So be cognizant of your body positioning, and things like that. So that's all I got, guys. So it's Sunday, as you can see in my kitchen, because I don't have the lights on. It's getting kind of dark. So what I'm going to tell you guys, this week, it's going to be nice outside. So my advice to you is get out there and enjoy it, because we all know the summers here in Pittsburgh, weather-wise, we only see about 55 days of sunshine. So get out there and enjoy it while it's still here. All right, guys, have a good week. I'll be back for more tips for your everyday life a little bit later in the week. Love you all. Bye.